1. When designing a corrective exercise program, what is the primary purpose of conducting a comprehensive movement assessment? A. To determine the client's preferred exercise intensity. B. To identify muscular imbalances and movement dysfunctions. C. To evaluate cardiovascular endurance levels. D. To develop a strength-based periodization plan. 2. Which of the following represents the correct order of the corrective exercise continuum according to NASM? A. Activation, inhibition, integration, lengthening. B. Inhibition, lengthening, activation, integration. C. Lengthening, inhibition, activation, integration. D. Integration, activation, inhibition, lengthening. 3. What is the most appropriate tool to evaluate postural deviations during an initial client screening? A. Bioelectrical impedance analyzer. B. Overhead squat assessment. C. 3-minute step test. D. Resting heart rate monitor. 4. When designing a corrective program for a client with rounded shoulders, which muscle group should typically be strengthened? A. Pectoralis major. Upper trapezius. C. Rhomboids and lower trapezius. D. Levator scapulae. 5. A corrective exercise specialist identifies underactivity in the gluteus medius. What phase of the continuum should address this issue? Inhibition. Lengthening. Activation. Integration. 6. When educating adult learners in corrective exercise principles, which instructional approach is most effective? A. Memorization drills. B. Passive listening. C. Problem-based learning with real-world scenarios. D. Instructor-centered lectures. 7. What is the primary goal of the inhibition phase in the corrective exercise continuum? A. Improve joint stability. B. Release overactive muscles through self-myofascial techniques. C. Increase muscle hypertrophy. D. Enhance power output. 8. Which method best measures the effectiveness of a corrective exercise intervention? A. Number of repetitions completed. B. Post-intervention movement assessment results. C. Client's perception of exertion. D. Weekly attendance rate. 9. What type of feedback promotes long-term skill retention in adult learners? A. Immediate corrective feedback after every movement. B. Delayed reflective feedback allowing self-assessment. C. No feedback at all to encourage independence. D. Negative feedback emphasizing errors. 10. Which communication strategy most effectively supports behavioral change in corrective exercise clients? A. Giving direct orders. B. Using motivational interviewing. C. Providing prescriptive solutions only. D. Correcting errors without discussion. 11. What should a corrective exercise specialist do first when a client exhibits significant asymmetry during a movement screen? A. Refer to a medical professional if necessary. B. Increase exercise intensity. C. Focus on maximal strength development. D. Skip the corrective phase. 12. Which regulatory consideration is most relevant for a corrective exercise specialist practicing in the U.S.? A. Federal nutrition labeling laws. B. State-specific scope of practice guidelines. C. International travel policies. D. HIPAA exemptions. 13. What is the primary focus of the integration phase of the corrective exercise continuum? A. Activate isolated muscles. B. Combine multiple movement patterns. C. Improve passive flexibility. Focus on static stability only. 14. What is the most appropriate communication strategy for an adult client resistant to corrective feedback? A. Repeating the same cue loudly. B. Demonstrating empathy and explaining rationale. C. Ignoring resistance. D. Switching to unrelated exercises. 15. Which muscle is most likely overactive if a client demonstrates knees moving inward during an overhead squat? A. Vastus medialis oblique. Gluteus medius. C. Tens fasciae latae. Anterior tibialis. 16. What is the best way to evaluate whether a client's corrective exercise plan has achieved its objectives? A. Compare pre- and post-program movement assessments. B. Rely on subjective reports of comfort. C. Track calories burned. D. Monitor body composition. 17. What is the role of activation exercises in the corrective exercise continuum? A. Reinforce proper movement through isolated strengthening. B. Increase joint range of motion only. C. Prepare the body for maximal lifts. Promote muscle relaxation. 18. When developing a curriculum for teaching corrective exercise principles, what should be prioritized? A. Rote memorization of muscle names. B. Sequenced learning from assessment to integration. C. Random exercise demonstration. D. Peer competition. 19. During a mentoring session, what approach enhances the mentee's confidence in corrective programming? A. Providing constructive feedback tied to observation. B. Giving only positive comments. C. Assigning complex cases immediately. D. Avoiding questions to save time. 20. Which movement pattern is primarily evaluated during the single leg squat assessment? A. Core stability. B. Lateral hip stability and ankle alignment. C. Shoulder mobility. D. Upper body strength. 21. Which principle of adult learning suggests that learners are more engaged when they understand how the material applies to real-world problems? A. Readiness to learn. B. Orientation to learning. C. Need to know. D. Intrinsic motivation. 22. A client presents with low back pain during hip hinge exercises. What should be assessed first? A. Hamstring flexibility. B. Core stability. C. Shoulder mobility. Grip strength. 23. What is the best method for evaluating the success of a mentorship program for new corrective exercise specialists? A. Tracking mentee satisfaction surveys. B. Observing mentee skill application in client programs. C. Monitoring attendance during mentorship sessions. D. Recording the number of feedback meetings. 24. Which muscle is typically lengthened when addressing an anterior pelvic tilt? Hip flexors. Hamstrings. Rectus abdominis. D. Gluteus maximus. 25. When delivering complex exercise instructions, what technique enhances understanding? A. Chunking information into smaller steps. Speaking faster. C. Using only written instructions. Demonstrating once without feedback. 26. During the inhibition phase, which tool is most effective for self-myofascial release? A. Resistance band. Foam roller. CRX suspension system. D. Kettlebell. 27. When assessing an overhead squat, what compensatory pattern indicates possible tightness in the latissimus dorsi? A. Arms fall forward. B. Knees move inward. C. Feet turn out. Low back rounds. 28. What is the main benefit of using video analysis in corrective assessments? A. Reduces need for professional expertise. B. Provides objective movement tracking and feedback. C. Eliminates need for follow-up assessments. D. Focuses on aesthetics. 29. What is the best mentoring technique for new professionals learning corrective exercise design? A. Guided practice with real client cases. B. Independent research only. C. Group competition. D. Memorizing definitions. 30. Which cue would best help correct a client's excessive forward lean during a squat? A. Drive your knees forward. B. Keep your chest up and core tight. C. Relax your back. Lean into your toes. 31. When evaluating a client's hip mobility, what movement test is most appropriate? A. Thomas test. Push-up test. C. 3-minute step test. D. Shoulder reach test. 32. What should be included in a post-program evaluation report? A. Pre- and post-assessment data and progress summary. B. Only client attendance records. C. General exercise trends. D. Nutritional recall forms. 33. When teaching clients to use foam rollers correctly, what instructional method enhances comprehension? A. Visual demonstration combined with guided practice. B. Reading a written handout only. C. Providing only verbal instructions. D. Independent trial without guidance. 34. What strategy ensures adherence to corrective exercise programs among adult clients? A. Goal setting and progress tracking. B. Daily mandatory testing. C. Excessive technical language. D. Minimal feedback. 35. A client demonstrates overpronation during gait analysis. Which corrective strategy should be prioritized? A. Strengthening the posterior tibialis. B. Stretching the anterior tibialis. C. Strengthening the gastrocnemius. D. Isolating the peroneals. 36. Which of the following is most appropriate when providing feedback to adult learners after a movement assessment? A. Focus on specific observable behaviors. B. Generalize the feedback for faster delivery. C. Avoid feedback until the next session. D. Provide feedback only in written form. 37. During the activation phase, which exercise best targets the transverse abdominis for core stabilization? A. Plank with drawing in maneuver. Crunches. C. Back extensions. D. Standing bicep curls. 38. Which regulation must be followed when storing client health data electronically? A. HIPAA compliance standards. B. Occupational Safety and Health Act. C. Fair Labor Standards Act. D. AD accommodation policy.